So special test for lumbar PIBD case. Suppose if we have a L4-5 or L5-S1 lumbar intervertebral disc prolapse and the patient is complaining of radicular pain, say going down the right lower limb. Then the special test always starts with well leg raising test first. We ask the patient to lift up his well leg, that is the leg that is not paining. And normally this should be free. The patient should be able to lift the leg up himself, which is known as active, or we should be able to lift the leg straight up with the knee totally extended up to any level possible. So this is well leg raising test. This is positive only in cases if we have a huge central disc at L4-5 or 5-S1. When raising this leg up causes pain in the right lower limb. So this is the first test, that is well leg raising test. Second is in the leg that is affected, that means the leg in which we have the radicular pain going down, we do SLR. First we ask the patient to lift the leg up straight himself. So पैर उठाओ अपना ऊपर जितना उठा सकते हो, like this. Supposing if the patient is complaining of radicular pain going down the limb, say at 40 degrees, then we call it as active SLR positive at 40 degrees. Now SLR is normally positive. The significance of positive SLR is between 30 to 70 degrees. Because between 30 to 70 degrees only the nerve starts to get a stretch. If it is positive before 30 degrees, then also it is relevant, and after 70 degrees it is equivocal because the hamstring might be tight in that particular patient. So first we ask the patient to do active SLR. In that, important thing is the knee should be straight. Then we do the passive SLR. For passive SLR, we keep one hand over the knee so that it is always extended, one hand under the heel, and then we lift it up till the patient starts complaining of pain. Supposing he is complaining of pain at say 60 degrees, so we call it passive SLR positive at 60 degrees. Now the modification of this is, if the patient is complaining of pain supposing at 60 degrees, we lower the leg little bit so that the pain goes away, and then we dorsiflex the ankle. When we dorsiflex the ankle, the nerve again gets stretched and there is a positive, this is known as positive Bragard sign. So if because of the dorsiflexion the pain reappears, the test is positive. Similarly, supposing if active SLR or passive SLR is positive at 60 degrees, we bring it again down to 50 degrees. This time we don't dorsiflex the ankle. We push the popliteal fossa hard using our palm. Because of this, the nerve gets stretched again. This is known as positive Bowstring test. So this is another special test for nerve stretch. Now, the third test in this continuation is the Fabers test or the Patrick's test. Now the next test is the Fabers test or the Patrick's test. For that, on the involved side, we lift up the patient's leg like this. We keep the ankle free and over the thigh. We have to make sure that the entire leg here is above the knee level. We stabilize the ASIS using one hand so that there is no rotation of the pelvis when we do this. And then with the other hand we apply pressure over the knee joint in the downward direction. So I stabilize the ASIS like this and then I push the leg down. So now this test can be positive in three ways. If there is any hip joint related pathology like arthritis or something else, then the patient will complain of pain here at the hip area, and also we might not be able to push the leg below the level of the other leg. That means this knee will remain above the level of other leg. Secondly, if the patient is having SI joint problem, then patient will complain of pain here at the SI joint region. Or third, if patient is having lumbar PIBD, especially of the lower nerves, especially say at L4-5 or L5 region, then when I'll do this by fixing the pelvis, patient might complain of pain going down the leg. Below the knee, if there is a radicular pain on doing this test, then it is positive for lumbar PIBD. Now, continuing with the other forms of special test, we have already discussed about the sitting SLR. That means we ask the patient to sit, and while sitting, if the patient complains of similar pain traveling down the leg, then this is sitting SLR, or this is again SLR test positive. Similarly, we can also do it by making the patient sit on the side of the couch like this and lifting the leg up. When we lift the leg up, again the nerve gets stretched and the patient might complain of pain traveling down the leg. Or if the pain is too severe, patient might even lean backwards, support the body using the arms, and this way he can relax his nerve and the pain goes down. Now these tests were all for L4-5 or L5-S1 related disc issues. Now if there is a disc higher up, say in the upper lumbar spine, and the femoral nerve is getting stressed, then we do what is known as a femoral nerve stress test, or sometimes it is also called as the reverse Lesigus sign. So for that we ask the patient to lie on the tummy. अपने पेट पे लेट जाओ. We flex the knee like this and then we raise it. So while doing this maneuver, if the patient complains of pain traveling down in the distribution of the femoral nerve, then that indicates that there is a disc high up which is pressing the nerve, femoral nerve, and that is eliciting the pain going down the leg. So this is known as the femoral nerve stress test for disc high up in the lumbar spine. So the next special test in this sequence is the lateral bending test. If some person is having disc problem at say L4, L5 or L5-S1 and he has radicular pain going down the leg, supposing in this case if we say towards the right side the radicular pain is there, we ask the patient to bend to the opposite side. If while bending to the opposite side the pain in the affected leg increases, then it represents that the pressure is from the medial side. So basically if the person is bending on the opposite side, it might be an axillary disc. On the contrary, if bending onto the same side, increases the pain on the affected side, then the pressure is from the lateral side. That is, the pressure is from the lateral side of the root. Then it might be a shoulder disc. So this test helps us to distinguish the location of the two discs based on the clinical assessment when we bend the patient to the opposite side or to the ipsilateral side, and which bending increases the pain in the leg.